the parent who comes stressed out.
Yes.
They're running around now. They're going to crash. Well, 2040. No, I said the several patients. It will be run by kids. It will be run from here.
Kids.
Yeah. I think we've managed.
Bolton, he also thought when it opened, I'll be dead. Let's see. I know, it must go in there.
No, it is like.
Oh, you should be opening. Just, I don't know what we're going to do with. When it's your turn, they're going to be lying here as they did. President of to deliver this latest. And that's what we got. Environment. Yeah. The surgeon would have a camera that. It's a teaching hospital. Oh, a different one. So yeah. Now showing also when it's on. So what do you see from there, because you're seeing then identifying those children that can be able to be comparable to. So we would look at that and then say those patients are there on conditions that we don't treat here.
We're going to be dealing with heart and heart issues, surgical and so on. It's basically a surgical hospital. Most of the children who come here would be surgical patients. It works on kidney, it works on issues of bone marrow, cancers amongst children, all of those at a much higher level of complication. And so you can do something for South Africa. It will still be overwhelmed if you don't at the same time transform healthcare systems throughout the sub-region. So it's intended not so much to have every child in the sub-region coming here, but to train enough for the sub-region to benefit from the training. We needed $100 million. We had not a penny. So we then had to go out and find money. We couldn't get banks to finance us because there's no way that we could pay it back. So we're not looking for people who were going to donate. But we've marketed it, and that's what it is, as a shared legacy. And we asked those people who wanted to share in Mandela's legacy. And they would then see that sharing in the naming of various facilities. It was very difficult to do it without him. He was, he was still with us when we started. He wanted to do things, but his health was not that good. So the reality is, I had to learn quickly to run without him.
We would be seeing the majority of the children being unable to pay, and no child therefore will be turned away because they cannot pay. But those who are able to pay, we would like them to pay because otherwise you cannot sustain the hospital. It will be funded, the operational costs, by government, and the other portion will be funded by the cash-paying patients. We are proud, we are excited that ultimately, come the 2nd of December, we would officially saying, Africa, here is a hospital. On those conditions that you thought you need to go to Europe for, you can just go around the corner and find that the hospital will meet your needs.